In our first email, Katie wants to know, Dear Dr. Steve, I'm trying to give up smoking after 40 years. I once went cold turkey for 3 months, and that didn't help. I've heard about prescription medications. Do they have side effects? Well, Katie, every medication has side effects, but there are two main drugs that people take to help quit smoking. Bupropion, which is sold as Zyban and Wellbutrin, and another drug called Chantix. Bupropion affects chemicals in the brain like serotonin and dopamine. It can cause nausea, constipation, weight loss, and dry mouth. Some more serious side effects include agitation, a fast heart rate, hallucinations, and seizures, but those are much less common. Chantix works differently. It blocks nicotine receptors in the brain, so it doesn't have an effect. This works fairly well, but it does cause nausea in about 30% of the people who take it. Chantix can also cause serious side effects like depression, thoughts of suicide, as well as agitation and a change in behavior. Because of this, these medications should only be taken under the care of a doctor, so beware of the signs. In our next email, Ed wants to know, Dear Dr. Steve, I'm concerned about my daughter. She's been diagnosed and treated successfully for hypothyroidism, but now she's developed an extremely low vitamin D deficiency. What should we do to help her? Ed, it's very easy to get vitamin D. Fortunately, we don't need a lot, only about 200 international units a day for the average adult. Many foods, such as dairy products, are fortified with vitamin D. We also make vitamin D in our skin when we're exposed to the sun. All you need is about 10 minutes of sun exposure a day to get enough. If your daughter is doing all of these things, you may want to consider vitamin D supplements. You can pick them up at your local vitamin store.